And thank you for inviting us to come and be part of the All India Ophthalmic Society meeting. Uh, Representing RANSCO, I now speak on behalf of the Sustainability Committee of RANSCO. I'd like to acknowledge the members of the committee and also Dr. Thiel. So basically, what is this big thing about sustainability? It's big. I mean, you need to talk about sustainability everywhere, and then suddenly it becomes important. But really, it's about meeting the needs of the present without compromising the ability of future generations to meet their own needs. Uh, you can't talk about sustainability without climate change. And, I was so pleased to see when I landed in Cochin that the whole airport was powered by solar. And I thought, I've never seen something like this before. Well done and congratulations. But usually, it all starts with climate change. And these relate to unusual weather patterns, whether it be rainfall, temperature, or extreme this thing. We talk about greenhouse gases, we talk about the greenhouse effect, where greenhouse gases trap the heat on the surface of the earth, and then we get warming. People talk about 1 degree, 2 degree, that's all very good, but the bottom line is that warming is happening. In Australia, for example, the mean temperature is going up, the rainfall is coming down, and we are used to famine, we are used to flood, and we are used to natural disasters. But it's not only about Australia. You can see that India, for example, you look outside, you see this nice serene waterway with houseboats, but the heat waves are coming, and surely places like Calcutta and Bombay, or Calcutta and Mumbai are definitely, and perhaps Cochin are also definitely at risk with climate change. Now, with climate change also comes the inability of the population to feed itself, and it's possible that up to 63 million people may not be able to meet their calorific needs. So, really, if the life of every child born today will be profoundly affected by climate change, and I think without doing anything, we are running into a big problem. It's not only on floods and famine, but also on human health. Lots of effects on the human body. Overall morbidity, mortality increases. There's a change in lifestyle, increased reliance on healthcare, and of course, we think there'll be more trachoma, the vitamin A deficiency, cataracts, and glaucoma. So I think we need to address this climate change business. And the IPCC has said, well, you could do this, you could do that. But basically, it's about what do we aim for. As doctors, we always like a sort of middle of the road approach. And I think really going down to the about 2.4 degrees target would be something that we can at least hope to think of. Um, Healthcare is a serious emitter of greenhouse gases. The healthcare sector is responsible for 10% of greenhouse gas emissions in the US. And operating theaters are, of course, a big culprit. And we, as ophthalmologists, have the highest surgical volume in medicine. So I think we have a rather big role to play. The feeling amongst cataract surgeons, or in fact all ophthalmic surgeons, is that everything is double packed, triple packed, and yet if you look at the data as presented by David Chang, he says that the post-operative endophthalmitis rate in the Arvind Eye system is less than what happens in the United States. Now, we're doing something wrong, aren't we? But let's look at what we can do to reduce all this by maintaining a high standard of patient care. So looking at decarbonizing your hospital practice. Now, this is an example from New Zealand, where that little area at the bottom is Wellington. We've got a lot of old people living on the way, and they come down for their intravitreal injections, bypassing many small clinics and regional hospitals that exist. So certainly reducing transport emissions would be something that we can think of in many situations by providing better transport. Cataract surgery can also be footprinted in terms of its carbon emission. If you look at the UK and you look at Wellington, they all have 180, 150 kilograms of CO2 emission, and yet you look at the Arvind Eye system and it's down to 6.2 kilograms. So we can do all this. What does 152 kilos of CO2 mean? It is the amount of CO2 that's emitted by one person living for 5.9 days. So you can imagine how much carbon is being produced by one cataract surgery. And even though New Zealand has renewable energy, but it still has a pretty large carbon footprint. The issue, of course, is procurement, and all the pack, repack, and sometimes something's put on the table and one doesn't use. I think we just need to start thinking of reducing, reusing, and recycling. Now, that's what you produce from one cataract surgery, and that's one of our committee members from the Sustainability Committee, and that's his cataract output for one day. That's his cataract output for 1 year. I mean, I think it makes a pretty compelling picture. So there are many ideas that we've got, but really it goes down to, reduce, reuse, and of course, if we look at other ways of doing cataract surgery, such as small incision cataract surgery, which is still the most common form of cataract surgery in the world, we have a much smaller, lower carbon footprint. And I don't even want to go to intravitreal injections because that is something that's just gone up in such an exponential fashion that I think we really need to think what we are really doing. So think about it when you're in theater next time, and when you leave the theater, ask your staff, well, are you putting the lights off? Are we using LEDs? Are we turning the air conditioning down? Because that's a serious source of CO2 emission. The NHS also has added one more thing to the mix, which is the use of gases both by the anesthetist and my retinal colleagues, because these also add on to the greenhouse gases. So here are the 5 R's that one needs to think of. But it's not only about climate change. There are also other aspects of sustainability, which I won't go into in detail, but financial sustainability. There's no point in setting up a system that can't run itself. And again, economics sustainability. And there's a good article by David Green, even though it was published in 2001, which really, as an ophthalmologist, because ophthalmologists are also business people. They run a practice, they run a hospital, they run a system. And really one needs to think about how we are going to, and are we doing it properly? And I think in this regard, there are a number of good examples in the region, in Southeast Asia and India and Nepal, where they lead the way in eye care delivery to the community. The charity dollar is another area of, waste, if not used properly, because the charity dollar is something I always feel people give for charity so that they can say, okay, just leave me alone and let me get on with my life and sort of, don't worry about those guys. But that charity dollar can be converted to a charity business dollar, where it can then start a process where things carry on for the future. To include things like gender balance or imbalance, diversity and inclusion, and setting up a sustainable workforce. In RANSCO, we have a policy where we would like to have at least 35% or more of female participation. We also look at sustainable work practices, and I think COVID has really changed a lot of that when we take the balance between working at home and working in the office, as has been the use of telehealth. So, what have we done as a college? We did a survey and found that 68% of our fellows agree that climate change is a big deal. And those who lived in the bush or out in the villages actually didn't seem to agree on this. And most of them agreed that we better do something about it. So the UN Sustainable Development Goals, or the SDGs, there are 17 of them. RANSCO has started and adopted 8 of them, which we can do something about. RANSCO has a big program setting up eye care for the future, which is called Vision 2030 and Beyond. And there's a similar program in New Zealand. But one of the big pillars of this program is sustainability. So whatever we do, sustainability comes into it. This committee is involved with advocacy, education, awareness raising, and also highlighting important examples in the world, such as the Arvind system. We have prepared practice guidelines for reducing waste in cataract surgery, and I think the Sustainability Committee is an important committee that reports directly to the board. We need to make a call for doing something, and I think as doctors, we are well respected in community, and I think this is really a call for all doctors to act. This compelling picture I show you again, because what's happening right now is we are not really shaping the future. I think we need to do something about that, and I think it's time we did it. So thank you.